While he's getting this set up, thank you so much for your kind attendance today. When Tel, with his energy, told me what this is about, I said, so tell me a little bit more about the organization. And he said, we're trying to use technology to do something called disruption. So I said, okay, that doesn't sound positive, Tel. Disrupt. And he said, no, I mean disrupt the whole status quo to make sure that you can improve it. So I said, okay, I'm game. So a little bit about my background. I'm a practicing physician. I'm an internist gastroenterologist. I also have another job where I host, and we founded a television show called Ask Dr. Nandi, which airs all throughout the United States and in 85 countries outside the US. So that's my entrepreneurship. And lastly, I'm also a patient advocate and a caregiver to patients. So what I want to talk about is a little bit what Rich talked about, and also Jay, which is the community and humanity, and how that relates to being an entrepreneur. So when we started our television show, Ask Dr. Nandi, the impetus was what? That, we had, my father was ill and really needing my help. He had a stroke that left him bedridden, and we found out the healthcare system really had a lot to be desired, and what could we do to change it? So we began our television show. So I talked about how can we remove the barriers to healthcare. As a practicing physician, I never was on the other side, that I had to be a patient. I always gave the care. And so what could I do to remove the barriers? Hope this works for us. And my title of my talk is this: how likes, tweets, and snaps are changing access to healthcare. So mobile health, and how that's going to impact the healthcare of our nation. So what's happening throughout the world? About a year ago, we received a message through Facebook. It was from a patient in South America. She said, "Doctor, I performed an abortion with boiled Pepsi last year. And I want to know if I can have a child this year." And just think about how astonishing that question is, and how much need there is for just basic health care. And that's when we realized that, when you reach people through what Tel talked about, when he started this whole conference, that Facebook or Twitter or Snapchat, it's not just for kids. These are individuals thousands of miles away who are asking me, "Dr. Nandi, what can I do?" Because they don't have the basics. Basic healthcare needs. It's not just in South America. I got messages from Farmington Hills saying, "My gallbladder is not working. What should I do? I'm having pain and fevers. What should I do? I'm having trouble swallowing. What should I do?" People don't have the basics of access to healthcare. Around the world, these are statistics: 400 million people without access to healthcare. 1.1 billion of us still smoke tobacco. And why is this? You're all entrepreneurs. Why is this important? Because to me, it's always got to be a win-win. Meaning that when you disrupt, and you're using technology to disrupt, let's see if we can decrease the 5.9 million children dying before their 5th birthday. Did you know that tuberculosis is the leading infectious disease? I mean, in the United States, we hardly think of that. But today, somebody will die of tuberculosis. That's the impetus for us to disrupt technology. That's the impetus for us to interact with mobile health. Cardiovascular disease, 17.5 million, and you can read the statistics. And this is throughout the world. So you say, well, that's great. That's wonderful. But what is happening in the United States? So my wife loves it when I'm on call, because I get all these wonderful little sounds in my phone as the hospital calls me. So one night I got a call about a man, during this time of year, ate too much chicken too quickly. So the emergency room says, "Doc, this man cannot even swallow his saliva. He's having excruciating pain in his chest, and we've tried to give him medicine. We did an x-ray. There's nothing else wrong. You got to come in." It's like 2 o'clock at night. And this is somewhat, for us, this is fairly common, and our years of training prepared us for it. But I was ready to get out and got dressed and was ready to go out there and go to the hospital, hair going this direction and that direction, disheveled, didn't shave, right? You go in there, it doesn't really matter. But I got a second phone call, and the emergency room doctor said, the patient has decided that he doesn't want to have anything done. I said, wait a minute, doc, it doesn't make any sense. He said he doesn't have insurance. He's afraid of the bill. He's afraid of what's going to happen when he has the treatment and what kind of a bill he's going to get. So he's going to wait until the next morning to figure out what to do. United States. Troy, Michigan, in a relatively affluent area. That's what's happening in the United States. 29 million people without health care, and a lot of people don't love it when I talk about the Affordable Health Care Act. Probably one of the few docs who say, I actually like the fact that we have more access. Is it perfect? Absolutely not. Could there be improvement? Absolutely. But now, our patients who didn't have insurance may have a shot, and don't wait until they have cancer before they see us. They don't wait till the heart attack before they come and see us. So I love the fact that we have a little bit less than 29 million people. Leading causes of death, right? Heart disease, cancer, and diabetes. Did you know, as we were talking in this conference, 12 women died of a heart attack? People don't know that. Women who are thinking that, you know what, it can't be me. It's got to be somebody else, taking care of everybody else. So we have enormous opportunity to reach out, to reduce the barriers to health care. And it's going to need people like yourself, disruptors, to say, how can we make it known to all the women in this room and the hundreds of millions and billions of people out there that women die of heart attack. #1 cause of death. For women, not just men, but women. And women say, you know what, it won't happen to me. So there's ample room in our society, not just in South Africa, South America, Eastern Europe, but happening right here. So why are people not getting access to health care? We all have ideas, right? So people say, well, the location, not enough money, maybe their education. I say one other thing. Anybody like going to the doctor's office, the hospital? Anybody here? Nobody raised their hand, right? People say, I love to go to the Henry. My wife and I like to go to dinner, but we never say, let's go to the doctor's office, yeah. Or go to the hospital, yeah. The director of our television show, he said something interesting. He said, my favorite part of going to the doctor's office is driving away and seeing the doctor's office in my rearview mirror, right? And most of you feel that. You come in, the whole idea of a patient is that you're waiting. It's the definition of who you are. You're waiting in a little room. It's intimidating. It's foreboding. And so, what can access do? Why are people not getting access? They don't want to go there. So, disruptors, people who are innovators, can make it so that the waiting room can become virtual. You can be in your pajamas, watching a screen, right? Communicating with your physician or your healthcare provider. What an awesome idea. Again, location, finance, education are important, but what can we do besides that? And that's what an innovator does, and that's what technology comes in. I know when my dad had a stroke, I went to every appointment with him. Everywhere you go, what happens is you feel like you're actually inconveniencing the doctor, right? You guys been there? You're like, oh, I just have like one little question. I know you're busy, but I just have this one little question, and then they're gone, right? I mean, you've got to like trip them up or lasso them or do something, right? Because they've got a chart in their hand, they're looking down, big white coat or something. It's intimidating. So I know firsthand, my mom had diabetes. I'd go to the appointments with them, and all of a sudden, no longer am I a physician. And that is why I wanted to be an innovator. That's why I wanted to say, what else can we do? We can't replace doctors, we can't replace hospitals, but how can we make it a little bit easier? Patients feel uncomfortable, patients feel powerless and helpless because you feel like you can't do it. It's changing, but the problem is, guess what course they don't have in medical school? Any guesses? Patient care we do, but we don't know really how it feels to be a patient. We don't know what it feels like to be on the other side, receiving the care. Because you know what happens is that you're kind of in charge. You know, when you're a physician, you're in charge of your office in the hospital, you don't understand what it's like to be intimidated. So we don't have a lot of training. And so disruptors, innovators will make that change. Patient portals are one way. So the leading cause of liver transplant in our country is what? Hepatitis C. Any symptoms? No. They're tired like you and I. Biggest symptoms that hepatitis C patients have is, I'm tired. Well, Callie and I for sure are tired all the time. We have little kids. So there's no real symptoms. Well, my patient who came in with hepatitis C, she had no symptoms, was terrified, came in the office to me, said, am I going to die? I read on the internet that I'm going to die of hepatitis C. This is what's going to happen to me. I said, Rebecca, no, it's going to be okay. You know, we have great treatment for this, and we're going to let you get the treatment and do well. So she's still worried. We treated her, and she travels all the time through patient portals. We're able to communicate with her and let her know what's going on. And that didn't happen. Like Tel talked about, that did not, wherever Tel went. That didn't happen when he first made this conference. Now we can communicate with people. Patients more engaged. Medical tests, you can access them like our hepatitis C patients. I can also schedule appointments. Email our medical staff. So the revolution of patient portals have changed the way my practice works. I can now talk to my patients and communicate with them, give them better care. Will that improve access? Absolutely. Can I then send an article to all my female patients that say, these are the signs of heart attacks for women, not the same as your husband or your brother, that women have atypical signs. Amazing, right? Simple ideas by disruptors revolutionizing medicine. That's what's exciting about what we're doing. What about healthcare on the internet? Have you guys met Dr. Google? Anybody? Knows everything. Can diagnose any condition that you possibly have. I had a patient came in, having a little trouble swallowing, said chicken, and some of the stuff you probably ate here today would get stuck in her throat. So she said, well, I read on the internet, I just got 6 months left. So just tell me, doc, what can I do to make the last 6 months of my life better? Well, I said, well, you know, let's just talk about this. It is possible that you could die in 6 months. However, it's much more likely you're not going to. So the internet has its negatives, right? People read, and anything you ever have, if we research, will eventually lead to what? Death. You could say I had, you know, a pain in my toes, death. You have, you know, headache, death. So there's some negatives. But here's what's wonderful about it. Most people have broadband at home, and I love the fact that most of my patients kind of have an idea of what's going on with their health care. 10 years ago, 15 years ago, wouldn't have happened. They come to me informed. I love that. And how can we make this apply to more and more people? My wife never ever uses the computer anymore. Anybody else have spouses that don't use the computer, just a smartphone? Anybody? My wife never uses the computer. Smartphone gets every bit of information that you possibly can. Again, done by disruptors, changing our healthcare, changing the access to our healthcare. Clinicians are the top source of health information, meaning that they get their health information from these websites, but we are the ones who are really curating those things. It doesn't mean people say, well, they're taking over what doctors were doing and really doing unnecessary tests, but they really look for our guidance. So internet is important and the web is important, but really it comes down to us and what we do with it. Power of social media. So we try to do something today called Facebook Live. Anybody else has done Facebook Live here? So we talked about breast cancer and nutrition. Reached 1.5 million people in 30 minutes. Imagine that. Reaching 1.5 million people with a smartphone and talking about information that revolutionizes people's lives. And that's what the power of the tweet, the like, the snap has done. I mean, that you can talk about Kim Kardashian and what she's done with social media, right? Different than what we're talking about. There's so many positives because now Patients have a place that they can get information. My office, my practice has a Facebook site. My television show has a Facebook site that reaches those people, reaches millions, to give them the real information. Instead of worrying about all the misinformation, we now have a way to be able to reach it. The next step is for disruptors and innovators is to take that technology and convert it in such a way that we can then deliver healthcare to people all over the world. Bill and Melinda Gates. Melinda Gates had a proposition, said, you know what, we want to give water to villages, but we can't reach them. But it seems like they can all get, what, Coca-Cola. She had a brilliant idea of putting the water on the same route as the Coca-Cola routes. All of a sudden, they get water. Imagine, when I'm in South Africa, you know, if you go to the townships of South Africa, I was there about 3 months ago, they get electricity from one tin house to another with live wires. That's how they get electricity. But guess what they do have? Facebook. They have Twitter. They give me questions on Facebook and Twitter. Wouldn't it be amazing if we could use that technology to reach these people where HIV is killing an entire country today? And that's what the innovator will do. You can not only save lives, but you can economically make that proposition affordable for a country that the entire government is struggling and spending millions and millions of dollars trying to reach these people. So that's what the innovator does. Take the power of social media and say, you know what, look beyond what dress the person's wearing, but saying, how can we let you know that there's treatment? And how can we let you know that there's hope? Large numbers of people, even without basic water and electricity, have social media. That is the opportunity for the innovator, for the disruptor. So we created this show, Ask Dr. Nandi, for that very reason. We took the power of television and the power of digital and the power of social media and put it together. One of our Facebook Lives reached several million. One of our posts reached 4.8 million. So instead of just talking about, hey, you know what, I just went to the bathroom and it was awesome. Or I just went to Justin Bieber's concert and it was great. We talk about, these are the symptoms of early Parkinson's. These are the symptoms of early esophageal cancer. But do it in a way that reaches people. And that's the power of the media. That's where the innovator comes in. People who say, you know what, I'm going to take these great sources of media, put them together, and reach people all throughout the world. And that's where you remove barriers. Remove barriers in any way you can. So how can you help? Anybody hear of heartfulness meditation? Anybody? I know a couple of you might have, right? Heartfulness meditation says something very unique. That the next revolution is not going to be with a machine. It's not going to be with the next gadget or the next business innovation. It's going to be where, I think Rich talked about. It's where hearts come together in such a way that's powerful. And what I mean by that is that all of a sudden, if in Sao Paulo a kid is dying, it's not their problem. Or if in Detroit a man is shot, it's not their problem. Or if in Mumbai, India, somebody is in the street starving, it's no longer their problem. Guess whose problem it is? It is our problem. The moment we do that, and that's the next revolution, we come together in what Jay talked about, a community. Not just a community about business, a community about humanity, where entrepreneurs take that power of humanity and then reach to the next level. And that's when we can really make a difference, not only in healthcare, but in general welfare of people. And I tell you it's coming, but it's going to take people like yourselves who are innovators and disruptors who are going to say, you know what, I want to be able to reach those people and make a huge difference in their lives. So let's go out and disrupt. Let's go out and innovate. Take the technology we have, but use it in a way that Rich is talking about, in a way Jay talked about, community and joy, and be able to use the business principles that you know to remove access, remove any barriers to access, not just for healthcare, but for prosperity and welfare. And it sounds like utopia or pie in the sky, but millions and millions of kids around the world. That's what drives them now. The word millennial is almost a bad word, people talk about, but you talk to them, they are starting to understand and believe in that. The moment we can jump on that and use our expertise in technology to do this, that's when we can reach the next level. So I appreciate you all coming here and giving you my attention. So as I always say in all of my talks, namaste, and I will definitely see you at the rest of the conference. Thank you.